Your cholesterol is normal. Your doctor says you're fine. But heart disease is still the #1 killer in America. And here's the uncomfortable truth. Many people who suffer heart attacks had normal cholesterol. So what are we missing? Today, I'm going to show you why one number does not define your heart risk and what actually does. If your cholesterol panel looks normal, that's good news, but it's not the whole story. Most standard blood tests measure total cholesterol, LDL, HDL, and triglycerides. Useful? Yes. Complete? Not even close. Heart disease isn't caused by cholesterol alone. It's driven by damage inside the arteries. And that damage often starts silently. Let's talk about inflammation. When your blood vessels are constantly irritated by stress, poor sleep, processed foods, or high blood sugar, the inner lining becomes vulnerable. LDL cholesterol can then stick to those damaged areas, and that's how plaque begins forming. You can have normal LDL and still have high inflammation. Next, insulin resistance. If your blood sugar runs high often, your body pumps out more insulin. Over time, this shifts your cholesterol into a more harmful pattern, smaller, denser LDL particles that are more likely to enter artery walls. Standard tests usually don't measure particle size, so you could look fine on paper, while your risk quietly builds. Now let's talk about triglycerides. High triglycerides combined with low HDL is a major red flag. That ratio often tells you more about metabolic health than total cholesterol ever will. Another overlooked factor is arterial stiffness. Your arteries are supposed to expand and contract with each heartbeat. When they stiffen, blood pressure rises and strain increases. This doesn't show up on a basic lipid panel, but it absolutely affects long-term risk. And then there's coronary artery calcium. Some people with perfect cholesterol numbers have measurable plaque buildup. Others with slightly elevated LDL have zero plaque. Risk is about context. Family history matters, blood sugar matters, sleep matters, stress matters, waist size matters. Heart health is a system, not a single lab value. The good news? Most of these risk factors are influenced by daily habits. A 10-minute walk after meals improves blood sugar control. Strength training improves insulin sensitivity. Better sleep reduces inflammation. Whole foods stabilize triglycerides. You don't need perfection, you need consistency. If your labs are normal, celebrate that, but don't assume that means you're invincible. Ask better questions, look deeper, pay attention to patterns, not just numbers, because the goal isn't normal, the goal is resilient. And your heart deserves more than a checkbox on a lab report. If you want science-backed health insights without hype, subscribe to ZenUp. Because real prevention starts before symptoms.